Stomach cancer. Spotting 5 seemingly innocuous early signs that often fly under the radar. News. https://Times of India, indiatimes.com/e-times. Lifestyle. https://Times of India, indiatimes.com/life-style. Health fitness. https://Times of India, indiatimes.com/life-style/health-fitness. Health news. https://Times of India, indiatimes.com/life-style/health-fitness/health-news. Stomach cancer. Spotting 5 seemingly innocuous early signs that often fly under the radar. Trending. AA. Text size. Small, medium, large. Imagine this. You're enjoying a light meal, but suddenly feel stuffed after just a few bites. Or you're dealing with that persistent bloat after eating something simple. Many chalk it up to indigestion or stress, but what if it's whispering warnings of stomach cancer? This silent threat can creep up without fanfare, and recognizing its early signals might just save your life. But here's where it gets controversial. These symptoms often masquerade as harmless, everyday nuisances, sparking heated debates about when casual complaints should trigger a doctor's visit. January 7th. Early indicators of stomach cancer that folks frequently confuse with basic acid reflux. It's all too common to attribute post-meal discomfort like bloating or nausea to acidity, a hectic lifestyle, or poor dietary choices. Yet, medical experts warn that sometimes these subtle issues could signal something far graver, gastric or stomach cancer. Dr. Ankit Jain, a senior consultant in medical oncology at Indraprastha Apollo Hospitals, explains that stomach cancer tends to progress stealthily. The initial signs are subtle and easily mistaken for typical stomach troubles, he notes. But catching them early can be a game-changer for survival. Let's dive into 5 early red flags that frequently get overlooked. February 7th. Experiencing early satiety, even with modest portions. Feeling overly full right after a few mouthfuls might sound like nothing to worry about, but it could be an initial alert. This occurs because an expanding tumor shrinks the stomach space or hinders its digestive processes. Eventually, it might result in reduced hunger and unplanned weight reduction. People often write this off as overindulgence or trapped wind, but if that sensation of fullness persists after tiny meals, it's worth paying attention. For beginners, think of it like your stomach suddenly having less room at the end. Not because you're full, but because something's taking up space inside. March 7th. Regular bloating or belching following meals. Post-meal bloating is one of those understated clues that slips by unnoticed. As the stomach's lining undergoes changes in the early stages of cancer, it can trap gas more readily. This might show up as repeated belching or a tight, uneasy sensation after ordinary eats, and that's when trouble could be lurking quietly. In contrast to short-term puffiness from rich or greasy foods, this kind often pops up even with bland, straightforward meals. To clarify, for those new to this, imagine your stomach as a balloon that's losing its elasticity. Gas builds up without escaping easily, leaving you uncomfortably distended. April 7th. Intermittent mild nausea without an obvious trigger. A sporadic bout of queasiness that hits without a clear reason, unrelated to bugs, expecting a baby, or eating off, should raise an eyebrow. It might originate from irritation along the stomach wall. The challenge with this sign is its unpredictability. Some days are smooth sailing, others bring discomfort. But when this gentle nausea turns into a recurring theme instead of a one-off, seeking professional input is advisable. For example, it could feel like a mild wave of seasickness that comes and goes, leaving you wondering if it's really serious or just a fluke. May 7th. Iron-deficiency anemia lacking an apparent explanation. Occult bleeding from the stomach's inner layer doesn't always manifest as obvious blood in vomit or stool. Instead, it's often minute losses that deplete iron stores, culminating in anemia. This can manifest through symptoms like pallid complexion, lightheadedness, breathlessness, or fragile nails. It's among the subtle hints your body provides when cancer is unfolding undetected. Beginners might liken it to your body slowly running out of fuel. Iron is essential for carrying oxygen, so low levels can make you feel drained without a visible wound. June 7th. Shifting ability to handle certain foods, particularly hearty or spicy options. Individuals in the early phases of stomach cancer may find themselves unable to stomach foods they previously relished. Robust, fiery, or meat-heavy dishes might now provoke unease, heartburn, or swelling. This isn't just everyday sensitivity. It arises because the stomach lining inflames and struggles to manage specific nutrients. If this newfound intolerance emerges unexpectedly, it calls for a medical review. Consider it like your stomach developing allergies overnight. What used to be a favorite meal now feels like a betrayal, hinting at underlying changes. July 7th. Disclaimer. This piece serves solely for educational purposes and does not replace personalized medical guidance. We strongly recommend reaching out to a certified healthcare professional if you encounter ongoing digestive problems or any troubling signs. Follow us on social media. Photo stories. And this is the part most people miss. While these symptoms seem vague, experts argue they're crucial for early intervention. But what if some folks see them as overhyped, suggesting they could lead to unnecessary anxiety and overtesting? Do you believe that spotting these signs justifies immediate action, or are they too ambiguous to act on? Is there a fine line between vigilance and paranoia in health matters? We'd love to hear your take. Agree, disagree, or share a personal story in the comments below. Let's spark a conversation.